Hello. I'd like to take a minute to talk about some of the common myths and misinformation regarding the COVID-19 vaccinations. It truly is amazing at how quickly we were able to develop a vaccination, but it wasn't because of any specific shortcuts. It was simply because of ingenuity. This technology, both the mRNA vaccinations and the soon to be vector vaccinations, are platforms that have been available for some time and already studied in clinical human trials in other situations, including vaccines. This simply was a very effective way at quickly developing a vaccination that's also going to be able to be adapted more quickly when necessary. The development, studying, and approval happened quickly because of the need from the pandemic and the fact that there were collaboration between the government and the pharmaceutical companies to move the production and study in parallel. So, in other words, a phase 1 trial looking at the concept with phase 2 trial looking at safety, and then phase 3 trials that were larger studies looking efficacy and safety could happen kind of more quickly because the pharmaceutical companies weren't waiting because they had the backing of the government to move forward, knowing along the way that the scientific method would continue to be applied and not moved forward beyond that if there was any question about safety or efficacy. So this was very important. The other thing I would point out that it helped was that we were in the middle of a pandemic with a lot of cases. So it was very easy to see once the vaccine studies started, in particular the phase 3 trials that had large numbers of people, that the people who got the vaccine were being protected at significant numbers compared to those who got the placebo. And so this allowed very quick determination that it was clearly very effective and also safe. That is not true because this is not a live virus or even an inactivated virus vaccination. This is a platform that uses a code. Again, both of the two current vaccines that are being administered and the likely two additional ones in the US to be potentially approved in the coming months. So neither one of those can occur because it's not a live virus. It's just simply producing the protein on the virus so your body can see it and develop immunity. So when the actual virus enters your cells, it has already seen that spike protein that it uses to invade the cells to block it.
Hi everyone. Let me answer the question of why healthcare workers in long-term care facilities should get the COVID-19 vaccine by first mentioning why am I taking the COVID-19 vaccine myself. I just received my second shot and I'm really excited about it. First of all, this is a very highly effective vaccine. So it will definitely protect me from getting sick from COVID-19. But more than that, I am relying on me getting vaccinated to protect my family members, especially my parents and my patients too. Our patients rely on us to do the right things. You know, in long-term care facilities, our resident population are at high risk for getting complications from COVID-19 and even deaths. We know that 40% of all deaths are happening in long-term care population. Some of our residents may not have the ability, because they may be severely immunocompromised, may not have the ability to mount the robust response with the COVID-19 vaccine that we are able to mount when we are healthy. So in order to maximize the impact of COVID-19 vaccination in the long-term care facilities, we will have to get both the staff and the residents vaccinated. In my mind, getting ourselves vaccinated is equal to showing our commitment to safety of our residents.
That's not true either. These are made up of a mRNA, lipid particles, and then buffer solution. None of that takes any sort of fetal tissue, nor was the development of these vaccines studied or used with fetal tissue. Everything we can see from all of the trials so far and the millions of people so far who have been vaccinated do not indicate any issues with fertility. I would also state that we do know COVID infection can affect multiple organs, and it has been found to occur in some of the reproductive organs in both men and women. And so vaccination may actually prevent some of those potential downstream down the road issues from infection. There's nothing mechanistically that would make us think that this vaccine would do anything to cause infertility.
So it is absolutely correct that even after healthcare worker in long-term care facility get vaccinated, they will still have to wear the mask, observe physical distancing, follow all the infection control protocols, and also get testing regularly based on the community positivity rate until that guidance gets changed. However, there is one thing that is going to get changed right away that is worth looking forward to. And you're thinking what that one thing is that is going to get changed so dramatically that will make our life better. In order to figure that out, you have to think, what is the one thing that is causing the most disruption in our life right now? The work life. And based on what I have spoken to the staff in the long-term care facilities, what they tell me is the biggest issue happens when somebody becomes positive in the building. And because they are positive, we have to do the contact tracing and we have to figure out which units were exposed. And then we have to put those units into quarantine. All the residents go into their room, and now the staff has to wear the full PPE before they enter the room, and then when they're coming out, they have to get the gowns and gloves off, and then have to go to the next room, so put the gowns and gloves back again and go to the next room. It's a lot of work. It's the right thing to do to save, basically protect yourself and protect your residents. It's the right thing to do, but it's a lot of work. So now think about that more than 90% of the residents, let's say, get vaccinated, and more than 90% of the staff get vaccinated. What will happen? What will happen is that your COVID-19 cases in your building will drop dramatically, which means that the exposures will go down too. And if there will be no exposure, there will be no quarantine, there will be no yellow zones. The yellow zones are the ones that are driving all that workflow disruption that we talked about. So there will be no yellow zone. There will be green zone only, and it's much easier to work in green zone. The residents can come out in the green zone, have communal dining, have social interaction. Now they still have to wear the mask, they still have to be physically distant, but they can have some interaction in a green zone. Otherwise, in the yellow zone, they're all in their own room, and there is no communal dining, and there is no group activities. So it will be good for the resident, it will be good for the healthcare workers of the long-term care facilities, because it will be less disruptive workflow. And I think we should be looking forward to that. Let's get on board. Let's get everyone vaccinated in the building so that we can get rid of those yellow zones, and we can continue to work in the green zones, so that our life, the work life, will be much better and less disruptive.
If you look at the ingredients on these two vaccines, there's nothing in there that has anything to do with a microchip. I think this false information, it's such a crazy idea, but it may come from the fact that the packages, when they're shipped from the distribution centers, have a tracking device on them so that they know where they're at as they move along the shipping pathway to their final destination. But there's nothing that's administered that has any sort of tracking chip. What I can say is that the expert bodies in this area, the American College of Obstetrics and Gynecology, as well as the Society of Maternal Fetal Medicine, have endorsed this vaccine for pregnant women or women who want to become pregnant or women who are breastfeeding. And the reason is that, again, there is nothing, this is not a live virus vaccine. The mechanism for these vaccines would not be expected to cause any harm from the vaccine to the mother or the fetus or the baby that's breastfeeding. What I will say is that there's clear evidence that pregnant women who get COVID-19 are at higher risk of developing more complications such as hospitalization, ICU stay, or even need for ventilators. This risk is even higher than a pregnant woman who gets influenza. So the benefits of a vaccine would outweigh the risks because of how significant the risk of infection is in a pregnant woman. Not to mention, we have seen COVID complications of pregnancy, such as fetal demise. We are still recommending the vaccination for those who have had COVID-19 because we have seen with vaccines that, or with this vaccination, that there is probably a more reliable immune response than with active infection. Previous infection does confer immunity, and it seems as though reinfection is very unlikely within the first 3 months, maybe even within the first 6 months, but there's still uncertainty about the durability of that immunity. So vaccination is still recommended. Now, during this time where we are more limited on our vaccination availability, there is the option within the first 90 days to forego vaccination and wait so that somebody who hasn't had the infection and has no immunity could get the vaccine first. But there's no risk of getting the vaccination even if you've had the infection within any of that time period. What we've seen in the initial trials, and now frankly with the over 20 million people worldwide who has been vaccinated, the vast majority of side effects are the typical mild side effects that we see with vaccinations, like arm pain, maybe some muscle aches, headache, low-grade fevers, and those kind of things. Fairly mild, more common after the second shot, self-limited usually within a day and no more than 2, treated often with over-the-counter medications like Tylenol or non-steroidal anti-inflammatories like ibuprofen. But that really is the vast majority of the side effects seen. There have been no deaths attributed to this vaccination. The side effect that we are watching that would be considered more serious is anaphylaxis and a severe allergic reaction. That does seem to happen rarely. In general, the current data would say for about every million people vaccinated, maybe 5 to 6 cases of anaphylaxis. Out of those who have had anaphylaxis, nobody's died. They've all been treated, some of them not even requiring hospitalization. These 2 vaccinations that are currently being used, neither one of those have any effect on our DNA. They use a mRNA code, which is taking advantage of our body's own machinery to generate that spike protein, but it doesn't do anything whatsoever with our own DNA. And for that matter, the next 2 vaccinations we anticipate getting approved won't alter DNA either. That's something we all want to come to an end at some point and get back to normal. After you get the vaccination, we still have to follow those measures for a couple reasons. At this point, we are not sure it is clear that these vaccines prevent symptomatic disease. So they prevent the disease. What we are not clear about is whether somebody could be asymptomatic and have the virus to possibly pass on to somebody who's not immune or protected. Preliminary data is suggesting it does that, but we need more data. The second thing is, because of that, it would be we'd have to be very cautious, because until we get herd immunity, where we have a large percentage of our population, it appears to be probably more than 70% of our population vaccinated, that we would have to continue to do that to protect those who have not been vaccinated. Not to mention, this is a highly effective vaccine, 94%, meaning that's not 100%. So we need to continue to do those things while we're in the middle of this pandemic. But it is my strong opinion that widespread vaccination is going to be one of the most important ways we end this pandemic and eventually get to a point where we won't have to be so vigorous in the physical distancing and masking. Thank you for your time. Thank you for considering getting this vaccination. In my opinion, it's very important. And I encourage you, if you have any uncertainty, to ask a trusted medical source, including your own physician, regarding their opinion for this vaccination for you.